Hi guys, welcome back to another exciting episode. In today's topic, we are going to be talking about a very important topic, and today's topic is mostly for our pregnant moms and our new moms to be. Yeah.
My bedroom.
Again,
My bedroom.
clap for yourself. Can you read it so? Hi guys, welcome back to another exciting episode. In today's topic, we are going to be talking about a very important topic, and today's topic is mostly for our pregnant moms and our new moms to be. Yeah, there is this intense pains that come after delivery. It is so severe, very painful, and I've been seeing a lot of complaints on social media. People are complaining that they usually have this pain after delivery, and I thought it's wise that today I should be talking about it. This pain is very severe. I experienced it. Most mothers also experienced it, but you do not really need to worry about this pain, and this is why. The pain is called afterpains. It is postpartum pain. Yeah, it's a contraction that happened in the uterus. That is why you're having this severe pain. You know that before you got pregnant, your uterus is very small. It's actually small. So as you got pregnant, your uterus will start expanding, and it will get to the size of a big watermelon so that it can accommodate the size of your baby. So after delivery, the stomach, the womb, the uterus starts contracting to go back to its original form, and this process it undergoes is not actually a very easy process. So the process of trying to go back to its original state is the reason why you have this severe pain after delivery. You do not have to worry about it. It's a normal pain. It's pain that everybody experience, and I know that it's very overwhelming that okay, after delivery you feel that you're done, there is no more pain again, but after delivery there comes this intense pain. I know it's very overwhelming. You'll be worried and be angry that your stomach is giving you problem, but you shouldn't be, because it's a natural occurrence. But the only time you should be worried about this pain is when the pain comes severely and it does not end again. Like the pain can last up to 2 3 4 days, but when it's more than this duration, then you need to be worried. You can talk to your doctor about it. Normally this pain is not supposed to give you fever. It's supposed to reduce your bleeding, because after delivery you also bleed. But in a case where this pain is giving you fever, is making you to bleed more than the usual, then you can actually call your doctor. your, you can actually tell your doctor about it. Like it happened to me when I gave birth to my second child. Yes, that's my second child. The pain was so intense that I had to call the doctor. They gave me some medication, and it was able to subsidize the pain. So when these pains come after delivery, you should not be worried, but you should be worried when the pain is too intense and you cannot carry it. Then you can call the attention of the medical doctor so that they can know what to give to you. I know it can be very scary to have this pain, because in your mind you're like, after I've given birth, all the wahala of labor, everything has ended, but immediately you gave birth, another pain came. So it can be so worrisome. It will give you a whole lot of headache and all that, but you shouldn't be worried about this pain. The only time you should be worried about this pain is when the pain now lasts longer than it should. Normally the pain is not supposed to last longer than 2 3 days, but if it lasts longer than this number of days, it's not giving you fever and you're bleeding. Because the pain actually is supposed, one of the help of the pain is to reduce your bleeding after delivery, but in a case where it is now causing more bleeding, then that is when you should be worried and call the attention of your doctor. So I said that after pains are caused by the as a result of the uterus contracting to go back to its original size or its original form after delivery. But this pain also happens regardless the means through which you give birth, irrespective of the means you give birth, either CS or the normal delivery. You're expected to have this pain. Though those who give birth through CS, normally they don't really feel the pain that much because of the drugs they give them before their surgery. So most of this medication will subsidize the pain, but that does not change the fact that every woman will not undergo this painful pain. Should I say painful pain? Every woman will not undergo this uterus going back to this original stage. These contraction pains come stronger even after you've given birth to your first child. It comes stronger in your second, your third, as the case may be, because after you've given birth to your first child, the uterus now find it harder, it now has more work to do before it can go back to its former stage, to its original form. So it will now have to undergo through severe pain for it to shrink back to its original stage. For those who have given birth to their first child, subsequently you're likely to experience more of this after pains. And another thing I want to reveal to you is that this pain becomes more intense when you're trying to breastfeed your child. This pain will not even come more intense regardless of the means you use in delivery. But you should not worry, because it is during the breastfeeding period that you try to heal faster. While weaning your child, the uterus will be contracting. So it's even advisable that you try to wean your child more, try to breastfeed your child more, so that the uterus can contract faster, it can go back to the original stage. To all new moms watching, you're actually doing a very incredible job. The process you're undergoing, the pain you're undergoing, is that process you go through for your body to go back to its original stage. So I want you not to be worried. Don't think about it. Just know that it is the joy in motherhood. Just take it that it's those pains you undergo through because you're trying to birth or bring another life to this world. So I want to encourage you not to feel bad. Nothing should weigh you down. Don't feel bad of your, don't feel less of yourself that you're undergoing pain because you're trying to give birth to a child, because the pain is the proof of incredible healing and adjustment that your body is going through right now. So give yourself the grace, stay hydrated, and please do not hesitate to ask for help if you need one. Call on your doctor, call on your medical practitioners, let them tell you what to do when the pain becomes so intense. But I do not want you to be worried or be scared of this pain. I'm making this video to bring to your notice that there is a pain that come after delivery that might be very intense, though it is not as painful as labor pain, but it is painful. If you could endure labor pain, I'm also sure that you will endure this one. The only time you should raise an alarm is when the pain comes consistently, it comes with fever, it comes with unnecessary bleeding, and it doesn't stop. Then you can now call the attention of your doctor. Especially for those people, I know there are some people after delivery, they keep you in the hospital for like a week, for 1 2 3 4 days, for them to monitor you. But there are some people who actually give birth and there is no complication at all. They discharge them and they go home. But if you're already in your house and you notice this pain and it's becoming so severe, please do not hesitate to go back to the hospital so that your doctor can check and know what to do. But in a case where it is not severe, just take it that it is one of those pain that comes, and this pain is making your uterus to go back to its original state. And please don't forget, if you need any help, I'm always here to help you. Come with your questions, I'll give you your answer. Thanks for watching. Please don't forget to like and subscribe. See you in my next one. Bye.